They wanted you to go into New York City right now to get an examination.
Yeah, and so I said, I can't do that for obvious reasons.
This Army veteran, who asked we not use his name, lives in Connecticut. He has a benefits claim pending with the U.S. Department of Veterans Affairs. He says a VA contractor called him and said he needed to attend a compensation exam in person next week in New York City.
Definitely, not doing that.
It's an unnecessary risk. It's not just risky. There is no reason for the risk.
Harold Hoffman is a veteran himself and an attorney with the Veterans Legal Advocacy Group. He just filed this lawsuit asking the United States Court of Appeals for Veterans Claims to order the VA to stop performing in-person exams immediately for veterans in coronavirus hotspots.
Honestly, we think it's pretty tone deaf that they're sending at-risk veterans to at-risk places at this moment when they could just wait a few months.
The VA closed its 56 regional benefits offices, including St. Paul's, to the public on March 19th in response to COVID-19. So veterans question why they're still being sent to see private contractors for exams that are not medical emergencies.
Especially when, everything else has changed to, adapt with coronavirus. Why would they not? Why wouldn't the VA adapt to continue to help veterans?
The VA has not responded to KARE 11's request for comment. For KARE 11 Investigates, I'm AJ Legault.
You can read much more about this story and the lawsuit records themselves on KARE11.com.
Well, the Department of Veterans Affairs has stopped sending veterans into harm's way during the coronavirus outbreak. It comes in the wake of a KARE 11 investigation. Here's AJ Legault with the update.
Accept social distancing as a requirement for the next number of weeks.
That's Dr. Richard Stone, the Veterans Health Administration executive in charge, in a March 31st video asking veterans to not come to VA hospitals unless absolutely necessary.
I'm asking you to consider telemedicine for your visit.
But a KARE 11 investigation discovered the VA wasn't practicing what it preached. As of Friday, April 3rd, veterans were still being ordered to attend in-person pension exams at private contractors or risk having their benefits denied.
I was told that I had to show up, and the way the VA system works is if you don't show up for your appointment, the VA is entitled to automatically deny your claim. So I didn't have a choice.
Tom West, an Army National Guard veteran from Virginia, went to that pension exam April 1st, and he's severely immune compromised.
You're high risk for coronavirus.
I'm high risk for any kind of infection.
This Connecticut veteran was told he needed to go into the epicenter of the nation's coronavirus crisis this week.
They wanted you to go into New York City right now to get an examination.
Yeah, and so I said, I can't do that for obvious reasons.
Honestly, we think it's pretty tone deaf that they're sending at-risk veterans to at-risk places.
Harold Hoffman is an attorney with the Veterans Legal Advocacy Group. He filed a lawsuit Thursday asking a federal court to order VA to stop performing in-person benefits exams immediately.
It's an unnecessary risk. It's not just risky. There is no reason for the risk.
Here's investigative reporter AJ Legault.
KARE 11 began asking questions and published a report Friday morning. That same day, the agency ordered an about face, directing vendors to immediately stop holding in-person examinations in response to the COVID-19 pandemic. Over the weekend,
calling about your appointment you have with us on the 9th of April.
Veterans in Minnesota and across the country tell KARE 11 the phone calls,
that appointment has been canceled,
and texts poured in, stating due to coronavirus, VA has ordered QTC to postpone in-clinic exams until further notice. QTC is a private business with multi-billion-dollar-a-year contracts with the VA to do benefits exams. They changed their website over the weekend to state, per the VA order, they're postponing all in-clinic exams until further notice.
That decision is going to end up saving some people's lives.
For KARE 11 Investigates, I'm AJ Legault.
Tonight, a Care 11 investigation with national implications. Veterans denied benefits for not showing up to exams that the VA itself canceled due to the pandemic. Here's investigative reporter AJ Legault.
Was in Beirut in '83 when the headquarters got blown up.
4 years in the Marines, another 17 in the Army.
Iraq for 16 months as a hazardous response team leader for all of Baghdad.
Harry Payne's service impacted him in ways he's still discovering.
I distance myself from everybody.
His private doctor told him he has all the classic symptoms.
PTSD, combat-related PTSD.
He recently applied for VA benefits, but strangely, was denied.
And then you read the reason why, and I get even madder because it's just flat out lie.
The VA decision letter informing him of his denial acknowledges he's been diagnosed with a disability and even concedes it's related to combat. So, why denied? The letter states, "We received notification from QTC Medical Services that you declined to participate in the examination process for your claim."
I in no way refused to cooperate.
Harry was scheduled to be examined by VA contractor QTC on April 21st. But before that could happen, this news.
Well, the Department of Veterans Affairs has stopped sending veterans into harm's way during the coronavirus outbreak. It comes in the wake of a Care 11 investigation.
Care 11's investigation had exposed VA forcing veterans who were supposed to be sheltering at home to go to exams or risk having their benefits denied.
They wanted you to go into New York City right now to get an examination.
Yeah, and so I said, I can't do that for obvious reasons.
The VA did an about face, directing vendors to immediately stop holding in-person examinations in response to the COVID-19 pandemic. Nationwide, veterans like Harry got calls like this.
The appointment has been canceled.
They told you it's canceled, and then they sent a letter to the VA saying you refused to cooperate.
That's correct.
There are some roads a veteran should not be forced to walk alone.
I'll do some poking around, see what we come up with here.
Sounds good.
Care 11 began questioning Veterans Affairs, QTC, and Congress.
It shouldn't be happening.
U.S. Senator Joe Manchin of West Virginia sits on the Veterans Affairs Oversight Committee.
How does that make sense?
Not to anybody. From a grade school on up, it doesn't make any sense. It's ridiculous to do that to them.
VA sent Care 11 a statement, which says in part, VBA erred in the processing of this claim. We have retrained the staff involved in this incident. A QTC spokesman told Care 11 they never messaged the VA that Harry declined to participate, but they've worked closely with the VA and have verified that no other claimants were affected. It appears the veteran you cited was an anomaly. However, Care 11 discovered Harry is not alone. Members of Congress have been hearing from veterans who had the exact same thing happen to them. Manchin and other senators sent this letter last week telling VA Secretary Robert Wilkie his department must issue clear guidance so veterans are not needlessly confused or harmed during this unprecedented time. After Care 11 began asking questions, a VA employee called Harry to apologize.
And evidently your decision was canceled in error.
Correct.
Denied in error. And I apologize for the confusion.
His benefits claim was reopened and he was given an exam via video conference the very next day. 2 days later, his disability claim was approved.
I was like, man, that's quick. I couldn't believe how fast the whole process went once you brought this to light.
Meanwhile, Congress is vowing to get to the bottom of what's happening, even if they need to call VA Secretary Wilkie in for a hearing.
This will be taken care of immediately because we're very much concerned.
For Care 11 Investigates, I'm AJ Legault.
Despite warnings of delays and confusion, the Department of Veterans Affairs made a major policy change amid the COVID pandemic. Now, as AJ Legault tells us, a Care 11 investigation finds it contributed to thousands of veterans being wrongly denied benefits.
In the halls of power in the nation's capital,
the VA incorrectly reported the veteran as a no-show for a disability exam.
A problem Care 11's investigation exposed, discussed during a congressional forum.
However, we should not allow a single veteran's claim to fall through the cracks during this pandemic.
But that is exactly what we discovered VA allowed to happen to veterans like Marine Ben Juarez.
Oh, definitely. I mean, you're kind of lost in the sauce now.
Ben had a pending benefits claim. Records show he was scheduled to attend a medical exam with a private VA contractor, QTC, on April 7th. But before that could happen, this news.
Well, the Department of Veterans Affairs has stopped sending veterans into harm's way during the coronavirus outbreak. It comes in the wake of a Care 11 investigation.
Care 11's investigation had exposed VA forcing veterans who were supposed to be sheltering at home to go to exams or risk having their benefits denied.
They wanted you to go into New York City right now to get an examination.
Yeah, and so I said, I can't do that for obvious reasons.
The VA did an about face. Nationwide, veterans like Ben got calls like this.
That appointment has been canceled.
They were canceling all appointments until further notice due to coronavirus.
But then this letter came in the mail. Benefits denied. Why? It says because he missed the VA exam.
Did you miss that exam?
Oh, I missed it because they told me not to attend it.
This VFW rep told Congress it's happening a lot.
In many cases, veterans were reported as no-shows, even where the contractors themselves canceled the exam.
For the past 2 months, we've been asking why. Why and how was the VA making and not catching such obvious mistakes? Turns out it's tied, in part, to a controversial move VA made in the midst of the pandemic to cut veterans advocates out of the loop on benefits decisions.
Losing our opportunity to engage with VA and fix errors that could have been easily fixed earlier in the process.
Ron Quaddy is the Director of Claims and Field Operations for the Minnesota Department of Veterans Affairs, the local state agency that helps veterans navigate the complex VA claims process. In April, VA ended a decades-old practice of allowing veterans representatives and attorneys 48 hours to review benefits decisions for accuracy before decisions are finalized.
The 48-hour review is extremely important. On a regular basis, we find even simple errors that we can help the VA with.
In letters to VA Secretary Robert Wilkie and even President Trump, veteran service agencies warned that canceling the review period was a big mistake, in essence, preventing correctable errors from being resolved. The VA did it anyway. And veterans like Ben began receiving benefits denials with obvious mistakes.
It's just kind of frustrating because you have to go back to, almost feels like you have to go to the back of the line and restart all over again.
Now you tell me, that doesn't even make sense. And that's what we say, come on.
U.S. Senator Joe Manchin of West Virginia spoke with Care 11 last month and made this promise.
We'll get this corrected. I really believe we will.
He and a group of other senators then introduced a bill to require the 48-hour review period be reinstated. Care 11 flagged Ben's case to Congress and the VA. His wrongful denial was overturned and his claim reopened.
I'm pretty sure I'm not the only veteran that has been going through this dilemma.
He's right. Congressional sources briefed on the situation tell Care 11 18,000 claims were denied during the pandemic due to what the VA labeled missed exams. The VA is going to start reviewing those claims for accuracy next week. For Care 11 Investigates, I'm AJ Legault.
Internal government records obtained by Care 11 Investigates reveal veterans had as many as 20,000 benefit claims improperly denied during the COVID-19 pandemic. Care 11's AJ Legault has our continuing investigation that's already sparked nationwide reform.
It's an internal memo from inside the Department of Veterans Affairs that sheds new light on the scope of a pandemic scandal a Care 11 investigation exposed.
The VA sent me a letter saying my claim was denied.
Harry Payne reached out to Care 11 back in May. The 21-year veteran had recently applied for VA benefits, but strangely was denied.
And then you read the reason why, and I get even madder because it's just flat out lie.
The lie was in the denial of benefits letter he'd received. It stated he had declined to participate in the examination process for his claim.
I in no way refused to cooperate.
The truth was the VA itself had ordered the exam canceled due to the pandemic, Nationwide, veterans like Harry had received voicemails like this.
The appointment has been canceled.
Carol Evan began questioning the Department of Veterans Affairs and their private contractor QTC, which performs many of the benefits exams. We were told Harry's wrongful denial was an anomaly and an isolated case. But we quickly learned Harry was no anomaly. Other veterans from as far away as Texas, West Virginia, and California began telling Carol Evan they too had their benefits denied for not showing up to exams VA itself had canceled.
Did you miss that exam?
Oh, I missed it because they told me not to attend it.
This will be taken care of immediately.
Senator Joe Manchin and other members of Congress began asking questions, and the VA announced it was conducting a search of recently denied claims to determine just how big the problem was. That memo, obtained by Carol Evan, summarizes the results. It states, VBA has identified approximately 20,000 denied claims with one or more canceled examinations, potentially indicating premature or improper denial. Harry's denial was quickly overturned, and he's now receiving the benefits he deserves. Because of his story, impacted veterans nationwide are now receiving letters notifying them their benefits denials are also being re-examined. For Carol Evan Investigates, I'm AJ Legault.